Iboan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. As always, we tend to talk about topics that are of very importance to all our viewers. And now we are in times of COVID, and with new variants such as Omicron being detected, the global healthcare scenario is facing the biggest challenge it has faced for the past century or so. If we talk about Sri Lanka, for the past couple of weeks, amidst COVID, we have seen a rising number of dengue patients, which is also a very concerning scenario. So we thought it very timely and pertinent to talk about this dengue fever, how it manifests, what possible sort of treatment modalities are available for you, and how to prevent dengue. So to talk about this topic in depth, we have invited a consultant physician, Dr.Shehan Silva. It is with great honor and privilege that we welcome him to our studios this evening. Very good evening to you, sir.
Good evening, Dilshan.
So first and foremost, sir, now as I said, we are in times of COVID, but there are rising number of dengue patients as well. So what is the situation as it stands now?
Yes, Dilshan, rightfully you said that dengue is on the rise. Yes, humanity has three enemies: famine, war, and fever. And out of the three, fever is the worst. That's what William Osler, one of the new or modern Hippocrates in medicine, has said. I believe in that strongly, and we as a community and we as a tropical country are facing the scourge of dengue. Dengue is an endemic illness. We have it in our country, and we can't deny that we will never get rid of it because of various factors like urbanization. Our lifestyles are changing. Our villages are becoming towns and cities, and therefore it's getting more and more prevalent. More so, we have fixed our attention towards COVID-19 as of the end of 2019, and we have forgotten this enemy called dengue. And dengue is in the rise, particularly the reason is the rainfall that we encountered the last couple of weeks, 2 months. And you see that with that, as the rains begin to settle down, dengue starts to emerge. And if we do not give our attention towards dengue in the background of COVID-19, which is a greater problem, we will have this enemy striking us and we will be crippled very much.
Definitely. That is one reason why we thought of talking about this topic today, so that you don't lose focus, as Dr. Shehan Silva said, about this enemy that has been there throughout amidst our focus on COVID-19. We have to be very careful about dengue fever because it is rising its head again. So I know we have spoken about dengue on mainstream media over and over again, sir, but just for completeness sake, for the benefit of our viewers, what is dengue fever and what causes it?
So, dengue fever is a viral illness. It's not an illness that is caused by a bacteria, a virus, just like the COVID-19. Of course, just like any other virus, it can have many shades of appearance. So, what happens in dengue is transmitted by a vector. A vector is a vehicle. So, the agent is this particular mosquito that we call Aedes aegypti in particular. So, the issue is, if we do not have ways of tackling the spread of the mosquitoes, we are unable to tackle the spread of dengue. So, dengue, as I reiterate, it's a virus, and it will cause a lot of harm by when the mosquito bites a person, infects the person, and then we call it a period of incubation, which after the bite, up to 7 to 14 days, the virus can be inside the body, and suddenly you see that the body mounts an immunological reaction. The body tries to fight the virus, and the body produces various chemicals, we call them cytokines, and these chemicals will go and affect various things. So, the important systems that we talk about in dengue are particularly the hematological system or blood. What you would always think about dengue is dengue equals low platelets. It's not only that. There is a loss or there is a reduction of platelet levels, along with there is increased leakiness or there is increased permeability of the blood vessels, which causes a person to lose fluid out of the blood, the circulating blood vessels into the tissues, and therefore that can give rise to various symptoms.
Now, like COVID-19, sir, we know that dengue has various types or various serotypes. How many types are there?
So, dengue has mainly 4 types of serovars, as we call it. We call them DEN 1 through 4. And in a particular lifetime, you would see a lifetime of a person that you would see that dengue can be infected up to 4 times or more, because if I may catch dengue type 1 today, in about 2 or 3 years time I could get dengue serovar 3, and that can lead to another infection. Just like COVID-19, you see that just because somebody had COVID-19 last year, that's not going to be a foolproof mechanism of not being contracted with COVID-19. And the other reason is there is a lot of immunity related processes that happens where the body becomes primed or body knows that there had been an infection with dengue. So, the chemicals or the immunity agents that are produced for, let us say, dengue type 1 will mount a significant reaction on dengue type 3, and therefore you would get various deleterious side effects.
So, if I just clarify on what you said, so there are 4 types of dengue, and if you have contracted it once, if you get it again, is it more serious the next time?
Yes, it could lead to a more serious infection. Just as I said, the body knows, okay, I know how to tackle dengue type 1. So, now again dengue has come into the body, so I need to fight a little bit more stronger. So, the body will start producing more chemicals which will like carpet bombing destroy or damage various organs.
Right. Now, we spoke of Aedes aegypti, the vector that transmits this virus. I think it will be beneficial for our viewers because we know the cycle of this mosquito, that it's active at certain times of the day. What are these times that this mosquito is active?
So, this mosquito Aedes aegypti in particular is a very strange mosquito. It works at the times when the sun comes up and the sun goes down, particularly 2 hours before sunrise and after sunrise, and also 2 hours before sunset and after sunset. And you see that that's the time, you know, our parents, our elders, when we were children, they used to close the doors to avoid the mosquitoes coming in. Yeah. So, that's the basis of it. So, the dengue carrying mosquito works at that particular time. And I want to stress on the point that you can easily identify this mosquito. If you look at this picture that is there in the frame, you see that this mosquito has characteristic, white spots. More so, it's called the tiger mosquito. So, it's easy to identify, and so you need, if you see such a mosquito, you need to be careful of your environment. We'll talk about that, I suppose, later on.
Yes, definitely. That will be one area of discussion that we want to talk in depth about. Now, especially for our viewers, as Dr. Shehan said, the mosquito is more active if we take it in very simple form. It's from during dawn and dusk, if we say. So, it would be more, you should be more careful that you try to avoid getting bitten by this mosquito rather than combating it once you contract the disease. So moving on with our conversations now, if you contract a fever, especially in this backdrop of COVID and also rising infections of dengue, if a person does develop fever, how should they go about treating that? Should they just try to take paracetamol and see if the fever goes away, or should they immediately present themselves to a hospital? What is your advice?
So, I would start by saying that all fevers are not dengue, all fevers are not COVID, and sometimes even dengue can present without fever. So, if one presents with fever, let's say over just less than 24 hours, you need to make sure that you maintain general hygiene, as in try to bring down the temperature by taking a simple anti-fever agent. What I am talking about is paracetamol. So, you need to take a simple agent like that. Avoid by taking things like ibuprofen, diclofenac sodium. You have various trade names in the community going around. But these drugs called NSAIDs, or non-steroidal anti-inflammatory drugs. Why do we say that? Because those drugs have a potential, just like aspirin, to bring down the platelet count. If I may word it correct, to reduce the function of the platelets and to cause a tendency for one to bleed. So, if you are having a 1-day history of fever, please try to make sure that you take a simple agent like paracetamol. More importantly, you need to make sure that you don't get dehydrated. This is the time that you may be having nausea, you may be having loss of appetite, you may feel very uncomfortable, muscle aches, joint pains, etc., headache. So, if you are having those at that particular time, you need to make sure that your immunity get boosted. So, how do you do this? By taking plenty of fluid, hydrating yourself, and taking adequate amount of nutrition. That's the most important thing if you are dealing with a fever less than 24 hours. If the fever continues to go more than 24 hours, you need to make sure that you get proper advice from your physician, may it be a specialist general physician or your family physician. You need to consult, and say, I have fever, what shall I do? And then that would be the signal for you to proceed by getting maybe a full blood count initially. And if the doctor, the physician feels that you may be having other symptoms which may point out towards non-dengue or non-COVID or something like that, you need to do the other tests as well. So, that's the time that you have to, so a person who goes beyond 24 hours of fever, that's the time that you need to be sure that you are not dealing with dengue. And there are various other tests that are there to detect dengue in the initial phase. For instance, your physician or the doctor may tell you to even consider doing a test called the dengue NS1 antigen. So, these are this test will actually find out the antigen or the virus particles and the destroyed virus particles sailing through your blood, and by detecting that, the doctor would say, okay, you have contracted dengue. But not all dengues will fall into the category of the severe dengue that we talk of. But then that's the time that you need to be wary about the possibility of dengue being complicated. So, the dengue NS1 test may be done in that particular period.
Right. So, if I just pick one point that you mentioned in your answer, sir, about these NSAIDs that certain doctors use to bring down fevers, it is very pertinent that our viewers make sure that in these times of dengue that you do not use it. Like Dr. Shehan said, there are various brand names out there, but overall as a category they are called NSAIDs. So make sure that you don't take them to to control your fevers, because it can have very severe effects if it is indeed dengue that you are having. So now we spoke of a full blood count, and even our lay community is quite aware of what this is, about these platelets and white blood cell counts. So if we can just talk about the characteristic full blood count picture in dengue fever, what happens?
So, as time goes on, from the day of fever, day one of fever, you would see that there are various changes in the full blood count. So, everybody gets alarmed by the fact that somebody may be having a low platelet count. Platelets are constituents in blood that helps in clotting mechanism. So, even with a normal non-dengue, other type of a viral illness, the platelet count can go down. But you need to be aware that it's not only the platelet count that we as medical personnel worry about in somebody who has dengue. So, along with the platelet count, you would see that the WBC or the white cell count starts to go down. So, you would see that in a normal person, maybe you have a count of more than 5,000 per cubic millimeter. So, as day 1, 2, 3 progress, the white cell count may go down from 3,000, 2,000, even sometimes up to 1,000, sometimes even 500. So, that goes in parallel with the platelet count. Along with this white cell count and the platelet count, there is another factor, another marker that most of the lay community do not know of, and that is called the packed cell volume. Packed cell volume is actually, in simple terms, the proportion of red blood cells, or what you call as the cells that carry hemoglobin, when they are packed into let us say a compact area, how much percentage that it would account. So, if somebody is having a packed cell count in the normal or the initial full blood count, let us say 35%, with dengue you might see that it starts to rise. It rises, not the platelets and the white cell count, it goes down, but the packed cell volume, it goes up. So, when there is a significant rise, that is the time that we worry about the bad dengue, and that is the time when we think, when we say that the patient has gone into a critical phase in dengue hemorrhagic fever. So, just do not only worry about the platelet count, you need to you need to give space for your doctor or the health professional to consider the other 3 areas as well, to make a clinical judgment as to whether this is dengue or what kind of level of dengue it is.
Now, there is a belief held in society, which is recommended by certain doctors as well, that if you have fever, you need to get a full blood count only if it goes beyond 3 days. Does that still hold true, or do we need a baseline full blood count on the day 1 itself?
As I mentioned before, if you have a fever going on for more than 24 hours and in a period such as this, you may do a full blood count to see initially what level of blood counts you have, because that would help in comparing. If the fever prolongs, that will be helpful to compare and say, okay, this is how things have evolved, and this is how if dengue has struck you, this is how it is going to behave. So, if it is going more than 24 hours, please get advice from a medical person and be inclined to do a full blood count.
Definitely. Now, we spoke of certain symptoms and signs of dengue fever as well, but just for the benefit of our viewers, if we can speak about the symptom profile that we might see in a patient with dengue fever, I think that would benefit our viewers.
So, dengue fever in majority manifests in the form of a flu-like illness. What I mean as flu-like illness is they would have fever with chills, shivering, They may have body aches, severe muscle pains. Actually, the word dengue comes from a African word which means break bone fever. So you can imagine how much of pain that person would be having. So muscle aches, joint pains, and in particular headache, which is more specifically behind the eyes. We call it retroorbital pain. Yes. So if somebody has that type of symptoms, that's the common sort of symptoms that any viral illness would have. But then again, in particular, that headache is characteristic. That doesn't mean that if you don't have any of these symptoms, or if you don't have a headache which is behind the eyes, that is not dengue. So these are common symptoms that one would have. Along with that, we talk about other symptoms which we call them as constitutional symptoms. So they are non-specific symptoms, as like what you would get again in a flu or any common cold, nausea, vomitish feeling, maybe vomiting. Sometimes dengue patients may present with diarrhea, right? So those symptoms are also characteristic of any kind of viral illness, and also in dengue. Well, if somebody has significant dengue going on as of more than day 3, day 4, if the person becomes very ill, the appetite becomes worse and worse, body aches become unbearable, if there is relentless vomiting and profuse diarrhea, if there is reduced urine output, urine output is an indication that somebody is dehydrated and may be going to shock, as in the blood pressure may be coming down. If there is a manifestation of bleeding, we don't see it very often, but sometimes people can present with bleeding from the gums, maybe from the as in stools or in urine. And also if there is development of pinpoint rashes all over the body, especially the tummy area. And also, as you would see in this picture, we call this type of patients as being flushed. So you see that if somebody is having high fever and having very extensive red hue on the body, and if you were to keep the hand on the body, you would see that there is an imprint of that. That's called being flushed. So those are symptoms that are red signs. And also tummy pain. We need to talk about tummy pain, especially in the right side, where the liver sits below the skin and other structures. So if somebody has significant pain, that may be an evidence that the liver is getting affected. There is something called dengue hepatitis, or where you'd see, you would know. Sometimes your doctor would ask you to do a thing called ALT, AST level. SGPT, SGOT is the other term that is given, and you would see that may be rising. So if those symptoms are there, you need to be cautious, and that's a time that you may need to consider getting admitted. Along with that, if somebody has dropping platelets, if the dropping platelets are there, platelet count is there, coming closer to 100,000, that's the time that you need to come into hospital. So the drop in the platelet count goes in parallel, goes equally or hand in hand with this parameter that I called as packed cell volumes, where one is losing fluid and the blood becomes concentrated. So that's a marker, or we call them as surrogate markers, where we look at something through another's glasses, spectacles. So the drop in the platelet count is associated with the leakage of the fluid, and that's the time that you need to get admitted and get medical attention.
We are talking about dengue fever today because we have seen a rising number of dengue patients in the past couple of weeks in Sri Lanka, and we thought it very timely and pertinent to talk in depth about this topic. So before we went into the break, we were talking about the signs and symptoms and how the platelet count drops as the dengue fever goes along. So I have to ask you this question, sir, because we have seen that with dropping number of platelets, that some of our patients have been used to some home remedies. Some say crushing a pepper leaf and drinking that juice is beneficial, or there are some other concoctions that they take. Does it indeed have a place in the treatment of dengue patients?
Well, good question, because this is something that we come across practically in our clinical experience. Well, if in dengue, if I were to only worry about platelet counts, I would transfuse one patient with platelets to get the count going up. Well, that is not the mechanism in dengue fever. As I mentioned before, it is the leakage of fluid from the blood vessels into the space outside the blood vessels. So, what would happen is the blood becomes concentrated and the volume of blood becomes smaller, and the blood pressure can be affected, and that is called dengue shock, or it can manifest in this thing called dengue hemorrhagic fever. So, I wouldn't say that by just giving pepper leaf extract or these Ayurvedic concoctions that one could be rid of dengue. Well, I would look at the platelet count not being affected by any external agent like pepper juice, because I would know, okay, by the lowering of the platelet count along with the rise of the PCV or the packed cell volume, I know that this person is moving towards the phase that we call as critical phase. So, talking about critical phase, so dengue can manifest, the serious dengue can manifest in this form called dengue hemorrhagic fever, where it's only a very small proportion of patients that encounter this, who would have increased leakiness of the vessels and lead into the state of fluid loss, or we call it as the critical phase. So, this critical phase goes on for a period of 24 to 48 hours. So, the culmination of that period and the 48 hours after that is the time that we as doctors or health professionals consider very important. So, what do? We make sure that our patients who come with this phase are given adequate amount of fluid support. It may be through means of oral fluid, not just simple plain water, but things like maybe oral rehydration salts we call as Jeevani, or things like home remedies such as even soup, fruit juice, etc., which has an equal proportion of salt and sugar getting the fluid into the body and distributing it all over the body. So, that is one way of tackling that. If some person does not have an appetite and if there is vomiting, or if you see that the platelet count and the PCV drops to levels that are medically indicated, we would start on intravenous fluids, as we call as saline, or sometimes we use a fluid called Hartmann's. Just it's a solution which just has salts in it. So, actually dengue fever, there is no rocket science behind it. It's judicious use of fluid that requires. So, according to your body weight, we would tell you to take maybe oral fluid along with the saline that we would infuse you. And we need to make sure that you maintain a steady urine output. So, I appeal to you, if you have somebody coming with dengue fever, or if you get dengue fever, all we ask is one thing when you come into hospital: please make sure that you take this fluid that we tell you in the correct proportions, in the correct time, and make sure that you document what you drink and what you pass as urine. So, then we are able to balance, just like an accountant balance the ledgers in finances, we as doctors, we will balance how much of fluid one has lost and how much of fluid that has been retained. And that will tell us to tell you and our nursing team, this is the amount of fluid that we need you to need the patient to be on. And along with that, we will be monitoring your blood pressure, pulse rate, various other things like we do a thing called a capillary filling test, where you would notice that we would come and we will try to give some pressure on the nail bed and to see how long it takes for the nail bed to become pink again. So those are all indicators that would tell us that somebody is dehydrated. Along with that, we would give simple agents like paracetamol for your fever. We would ensure that you don't develop gastric irritation and your nausea is tended to by giving things like anti-gastric medication like omeprazole, pantoprazole, and things like domperidone for your vomiting. So this is what we do. If we see that somebody is deteriorating and we see that, let's say, suddenly there is a shoot of the packed cell volumes to more than 20% of the baseline that one would have, that's the time that we worry, okay, this person is going to shock. Along with that, you may not pass adequate amount of urine per hour. So that's the time then we would give extra saline, extra Hartmann solution. Sometimes we might even give plasma to resuscitate your body fluid status. And then we try to get you back into the normal vital parameters, the blood pressure, the pulse, and the urine output. So that's all that is done. So this critical phase, which we call critical phase, is a period that lasts 24 to 48 hours, more so like the Nonagata period, I would say. So that's the period that we are careful. And you see that almost at the end of 48 hours, you would start becoming better. And then your appetite will come back, you would become more better, your face will become more fresh, and your other parameters like the urine output, the blood pressure, those will improve. And we will see that there is a equal proportion of rise of the platelet count and the packed cell volume. And more importantly, you will be devoid of fever. Actually, the point where one settles down with fever, that's the time that we start to worry whether you are going into critical phase. That may be a paradox. The time that you might think, okay, I am better, I don't have fever. That's the time that we wonder, okay, is this patient going into a phase of critical phase? So if somebody has significant amount of dengue shocks syndrome, and then you see that again, although the hematocrit or the PCV, the packed cell volume goes up, and suddenly you see that there is suddenly a surge where there is a plunging of the packed cell volumes to lower volumes. You may be bleeding into your gut, you may be bleeding into the space which we call the peritoneum, which floats your intestines. So there you might have a thing called a concealed bleed. Although there is bleeding, it is just not seen because it's concealed or hidden. So that's the time that we might think of giving one blood, as in blood transfusion. So this is what we do. And at the end of that the critical phase, we go into the third phase, which we call the convalescent phase. The febrile phase or the fever phase that we spoke of, the critical phase which we spoke just now, and now we talk about the convalescent phase, which you would be well. And you may start to develop a rash, particularly on the palms of your hands and the soles of your feet, and then might tell, okay, doctor, I feel that I am itching. So when you start to itch, that's the time that we become relieved and we said, don't worry, we are happy that you might be able to go home. Yeah. So, but then now what would happen is whatever fluid that is leaked out into the spaces outside the blood vessels, it starts to get reabsorbed. So you would start to pass urine more and more, and your heart rate will go down. So you need to cut down on the amount of liquids that you may be told to drink. So you need to make sure that you heed to your physician's advice as to how much fluid that need to be taken. And then of course you need rest. I would reckon maybe about a 1 week's rest. If you particularly if you have had involvement of your liver, where your AST, ALT or the SGPT, SGOT, the chemicals of the liver are have gone up, that's the time that you have to rest. Having said all this, in a minute proportion, you would see that there would be other complications as well. You see that the pancreas, the organ that produces digestive juices as well as insulin, that can be enlarged or inflamed, and you have patients developing severe abdominal pain. Sometimes patients can have altered level of consciousness, very delirious, sort of very sleepy or becoming boisterous, along with new onset fits. So that may herald towards the possibility of dengue encephalitis, where the immunity markers like the antibodies have gone and attacked the brain cells. Sometimes you would see that there may be certain changes happening in the heart. The antibodies may be attacking on the heart and the electrical system, and you would get these palpitations. You would see that the heart rate is speeding up, and you might feel dizzy, etc. So that's the time, that's called dengue myocarditis. So we are careful, we need to be careful as doctors about these rare complications, and if those come, we would always attend to them. That's where we stand. That's pretty much how we would manage dengue.
Definitely. Now, that was a very comprehensive description as to how a physician would be managing dengue. If I just recap very briefly, dengue is divided into 3 phases: the febrile phase, the critical phase, and the convalescent phase. And like Dr. Shehan said, when the doctors start to worry is when your fever goes down, because usually our viewers would tend to get a sense of relief when the fever is coming down. But if you are having dengue fever, when the fever goes down, that's when you are possible to enter into this critical phase, and that's when the physician starts to worry. And like Dr. Shehan said, judicious fluid management is the mainstay of treatment for dengue. So if you are being advocated a certain amount of fluid to be taken, even if you are in hospital, it's your responsibility to ensure that you document whatever fluid that you're taking and whatever fluid that you're passing. So that is very important, and we want to reiterate that time and time again in management of dengue patients. So now, sir, we know that prevention is better than cure, and we know that certain measures have already been taken by government and our general public as well. But if we can just recap and reiterate on what really needs to be done to somehow try and prevent these infections.
So, in order for us to understand what to do, we need to understand how this vector or the vehicle called Aedes aegypti works. So, I would say that Aedes aegypti is a very picky or posh type of a mosquito. It breeds in clear, clean water. Unlike diseases like filaria, which we have eliminated in our country, the dengue mosquito breeds in clear water. What do I mean as clear water? This is water that gets collected into gutters. When we were children, we used to see on TV how people, how the media and the journalists used to say, okay, dengue gets spread on top of tires. dengue gets spread on top of ant traps on table legs, and tins and various receptacles that are thrown into the road. Maybe we see that we have become a little bit more attentive of our surroundings, but you see that dengue vector has learned to breed in sites where we do not see. Places like gutters, where we hardly would go up on our roofs to see what's been stuck up there. As you see in this picture, there are numerous places that the dengue mosquito can breed. Well, also places like, maybe certain foliage. You may be having things like cacti or single stemmed plants such as palm trees, etc., where the leaves meet the stem. So those places are pitchers for water to collect, especially after the monsoon season, like the period that we are in. So we need to be careful about that. We may be taking care of our household. We are limited to a very small space. We may be cleaning our gardens, our drains, etc. But even though we do that, we see that if our neighbors are not attending to that, the dengue vector can easily come from the neighbor's house, and we can be affected by that. So we as a community need to act on this. It's not okay, my household, myself, that's it. We have to have neighborliness, and we need to make sure that our community is clean. So that has to happen. So breaking down of this transmission include that mainly, primarily being informed, being aware of these things which we may be taking as oblivion or taken for granted. Along with that, we need to make sure that we maintain personal hygiene and etiquette. We need to use mosquito repellent agents. Sometimes things like mosquito nets. There are various chemicals which are non-allergenic or hypoallergenic to the skin, such as citronella oil or DEET. You get various roll-ons, etc. So that is where we have to do to protect ourselves and our children. We need to make sure that our windows and maybe our ventilation slits, those are attended to. Maybe you may be having mosquito nets placed on your windows as well as your ventilation slits, but make it a point to look at those, whether those are rusted and whether they are degenerating. So if that is so, that needs to be corrected. Look at the pipes. You don't always think about the gutters up in your roof. Think about your waterways, as in from your washrooms, whether those places are getting waterlogged. So that has to happen, and then you need to make sure that if dengue is detected, you need to make allowance for the medical team to notify it to the public health officers, the medical officer of health and the PHI, so that they would come to that environment, assess the environment, not only your household but also the neighbors' households as well, and see what can be done to rectify that. There may be space for smogging, where there is mosquito repelling fog or chemicals can be given, but that's not going to be a very effective way, because it will just chase away the mosquitoes who would return back. So it's the breaking down of the breeding places that is of utmost importance. So that has to happen, and we need to make ourselves aware. You may be living in Colombo 7 maybe in a condominium, and you would think, okay, there is no water collecting. You may be staying in the slums. All of us, whether it's the king or the pauper, whoever, we are at risk of this enemy. So we need to make sure that we have to be aware of this disease, and we need to make sure that our children and ourselves are protected from these bites.
Definitely, that is one message that we want to reiterate to our viewers. Maybe a king or a pauper, all of us are equally affected. Make no mistake, dengue is a killer, and we have to be collectively responsible to keep our communities, our children, our neighbors safe. So, like Dr. Shehan said, make sure that these breeding sites are destroyed. Be aware, the simple measures that you can do, be aware of your surroundings, of your home. Make sure that these breeding sites are destroyed and that you take the necessary measures that Dr. Shehan very correctly went on to describe to make sure that you don't get this infection. Like we always say, prevention is better than cure. Now, with the time constraints that we have, we are coming towards the end of this program. So, as a closing message to our viewers who are battling with the COVID-19 pandemic and now with the rising number of dengue patients, what would be your message for our viewers to keep them safe?
So, I would tell that if one comes across fever, don't try to make a diagnosis by yourself or through Google Auntie into making yourself fit into a particular disease category. So, you need to make sure that you get proper advice from a medical person. If the fever goes on for more than 1 day, have a low threshold in getting some of the investigations done, a full blood count at least, and make sure that you maintain general hygiene by taking adequate amount of liquid, good nutrition, fortifying your immunity. If the fever is going on, don't be inclined to bring that down by taking drugs called NSAIDs, examples being ibuprofen and diclofenac. If the fever is going on more than 24 hours to 48 hours, go directed by a medical person into doing various other investigations. If you have got dengue, don't be too anxious about it. I mean, it's easier said than done, but make sure that you stick to the advice that is given by your health professional while being in or out of hospital. But if you are in hospital, make sure that you make a count of the fluid that you are taking in and the fluid that comes out of you, so that we are able to direct you as to how much fluid that needs to be taken. And when you do recover, make sure that you rest rather than trying to go about with your day-to-day activities and also your jobs, etc. And also, it's essential that we keep our environment, our homes, our neighborhood devoid of the dengue mosquitoes by at least once a week looking into these places. It may be a place where we do not ever think that the dengue mosquito would go and breed, but make sure that you use your common sense and see whether you can prevent rather than being ended up doing frequent blood counts.
Definitely. Now, it was a very timely and pertinent discussion to talk about this dengue fever this evening here on Healthline. We thank Dr. Shehan Silva very much for gracing our studios this evening. Thank you very much, sir.
Thank you. It was a pleasure.
And we are passing some troubled times. We are facing a new variant of COVID-19. Omicron has already been detected in Sri Lanka. So we are by no means out of the woods as concerned to COVID-19. So make sure that you wear your mask, maintain social distancing, wash your hands, follow all the protocols that you have been following so far. and in doing so, don't neglect other aspects of your health. As we said, dengue is on the rise. Be alert, be aware, take collective responsibility to keep our communities safe. And with that message, I take your leave from this episode of Healthline. Until we meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, signing off, wishing all our viewers Aibowan.